Good morning from Miami. This is Dr. John Bennett, televising for Neurosurgical TV. Today we have the pleasure of starting an online conference of pediatric neurosurgery in collaboration with Deepak Gupta MD, a neurosurgeon from the AIIMS Hospital in New Delhi, AIIMS. He's assembled a tremendous cast of neurosurgeons from India. And also we're joined by a panelist. First we'll introduce the panelists, and then we'll turn it over to Deepak. Good morning, Francesca.
Good morning, everyone. I'm Francesca. I'm a fifth-year medical student from Bucharest, Romania, and I'm also this year the president of the Walter Dandy Neurosurgical Club here. And I am really excited to see what Dr. Gupta has to say.
Welcome. Okay, Dr. Gupta, it's all yours. Thank you very much.
Hi, good morning. It's 9 o'clock in the morning, Indian Standard Time. For my European counterparts and my friends in US, it must be quite early in the morning or maybe late night. So anyway, greetings to you from New Delhi, India. It's a pleasant morning outside. Basically, this is a move by our society and by myself to promote pediatric neurosurgical services, not only in India, but all over the world. Now, over next 2 days, there will be series of deliberations, debates, talks, lectures by very eminent neurosurgeons, mainly from India. They will be talking about various issues related to craniosynostosis, spinal dysaphisms, encephalocele, pediatric brain tumors, and so on and henceforth. And all the faculty are lined up. They will be giving a 45 minutes talk followed by 15 minutes of discussion. Anybody who joins this neurosurgical television on Google Hangout can ask questions directly to the faculty. And I believe and I understand John Bennett from Miami has done very hard work on this to set up this program, and this series of lectures will be available on YouTube and also on ACNS website, Neurosurgical TV, to be seen by the residents later on. So this is a good move, and it is one of the moves, I would say, to promote the non-existent pediatric neurosurgical services advancements in distant, far-off areas of the world. So probably we could begin with my initial talk, John, if you permit, on development of pediatric neurosurgical services in India.
Very good. Okay, perfect.
All right. So I'm presently working as additional professor neurosurgery at Neurosciences Center and Apex Trauma Center of New Delhi. I'm working in All India Institute of Medical Sciences. What is pediatric neurosurgery? Well, it is basically any beneficially intended intracranial intervention in a living child. That's the crux of pediatric neurosurgery, I would say. Now, pediatric neurosurgery excuse me, it exists as a member of the family of neurosurgery. If you go back to the ancient era or the history of neurosurgery, I would say the first operation of epilepsy in a child was done way back in 1886 by Victor Horsley. So I would say that was the beginning of modern era of neurosurgery way back in 19th century. We all know that Harvey Cushing's and Walter Dandy, they did operate on tumors of children, and extensive work is already published in the literature. Now, whether to have dedicated pediatric neurosurgical institutions for India or for the world, whether it's a reality or a virtuality, that remains to be questioned. There are two schools of thoughts. Some people think that you need to have those centers wherein only pediatric services are available. However, there is another school of thought which say that it is not actually practical. This is going to be very expensive and out of reach of the common masses to have dedicated pediatric neurosurgical centers in all parts of the world, I would say. But yes, in certain major metropolis, it is the need, and people are talking about pediatric institutions with multidisciplinary facilities and personnel to deal with complex pediatric problems, because it is difficult for a patient to move from one country to another country just to get the advanced neurosurgical care for these children. Let's say, for example, craniofacial abnormalities, skull-based surgeries, complex lipomas, and so on and henceforth. And of course, any institute if it is desired, they should also have neonatologists, pediatric intensivists, because they are a big asset to the pediatric neurosurgical centers. The most important thing is that a concept of teamwork. The teamwork approach of different specialties is actually required in case you want to have a pediatric neurosurgical setup. I would have a disclaimer to begin with. Should pediatric neurosurgery be practiced only by surgeons who have spent 2 years as fellows in certain self-appointed centers and who forswear all adult practice? Well, my answer is no. I do not believe in this philosophy that a general surgeon or a neurosurgeon who is practicing neurosurgery for many years should actually give up adult neurosurgical practice and start doing only isolated pediatric neurosurgery. What is the current picture? I would say the real picture of pediatric neurosurgery, not only in India but probably in other parts of the world. I will leave it to the panelists to comment on that at the end of my talk. Most of the places, congenital hydrocephalus spinal dysrhythm is actually being done by the pediatric surgeons in private setups. The neuroendoscopies for the hydrocephalus is being done by pediatric surgeons in private setups. I'm talking about endoscopic third ventriculostomy is being done. The craniofacial disorder surgeries or for the craniosynostosis is being done by plastic surgeons and by the pediatric surgeons in some centers. The craniocervical disorders, craniovertebral junctions problems, pediatric spinal tumors, congenital spinal deformities, they are being done by spine surgeons. We talk about pediatric brain tumors, they are being done by all. We talk about head injuries, they are being done by neurotraumatologists and by the general surgeons, yes, in some centers. Birth plexus injuries, brachial plexus injuries, they are being done by plastic surgeons. We talk about moya epilepsy, it is basically a part of the respective specialties in these fields. And we talk about the fetal surgeries in the pediatric neurosurgery, it is practically non-existent in our country. In some sections of the world, especially US, Brazil, yes, it is being done, especially after the MOMS trial. So that is the true picture of pediatric neurosurgery, I would say. Why it is not a sought after specialty? Well, I would say probably people think it is too easy to treat. It is meant only for the beginners. There is no rush of catecholamines or adrenaline with operating on kids, unlike in cerebrovascular or skull-based surgeries in the adults. Or maybe it's people find it difficult to communicate with the kids. Or maybe it has got least return. I mean, these are some of the factors I think are kind of responsible for this being not a very sought after specialty. Why no one actually took interest in adopting this subspecialty at my hospital in India, in New Delhi, and in major centers, I would say, is that probably there is a nihilism to take it up as a branch, because mostly people think it is nothing but operating on leaking meningomyelocele, shunt malfunctions, encephalocele, and occasional craniosynostosis, which actually is not true. The field is quite vast. You have chances and you can learn and do fellowships in doing pediatric epilepsy surgery, pediatric neuro-oncology, craniofacial work, congenital deformities of the spine, craniovertebral junctions, moya, cerebrovascular. The field is unending, I would say. Well, the pediatric neurosurgery in India, if you read about the ancient Hindu mythology and Charak and Shishut literature, the first head transplantation in a human being was carried out in Daksha Prajapati. He was the father of Parvati or the wife of Lord Shiva, and his head was decapitated by his soldiers, and subsequently it was the sheep head was transplanted on him. That is way back in Indian mythology, and probably some years later the same thing happened to our so-called Lord Ganesha. His head was again decapitated by his father, the Lord Shiva, in anger, and subsequently when Parvati asked his head to be returned, the head of an elephant was transplanted on Lord Ganesha, and he is popularly known as Lord Ganesha in Hindu mythology. So probably in Hindu mythology itself, people are talking about adult neurosurgery and pediatric neurosurgery a long time years back. Now, there are some special situations wherein you do need pediatric neurosurgeons. It is because a pediatric neurosurgeon is kind of up to date with what is happening in the field. Let's say, for example, you have a patient with opticochiasmatic hypothalamic glioma, with or without neurofibromatosis type 1. The operative dilemma remains whether to operate these patients or whether to give chemotherapy. Now, a surgeon or a person who is dealing with these cases on a regular basis, he will be the right person to manage such cases of opticochiasmatic hypothalamic glaucoma, because there are some cases wherein surgery is actually not required. You can very well get away by doing this, subjecting these patients to chemotherapy. This is a patient who came to me and was referred to me for surgery, and subsequently when I had a look at the scans and found that this patient had some neurofibromatosis, I subjected this patient to chemotherapy and the patient actually improved. This is another interesting child who was sent to me for surgery. If you look at the patient, patient has got bilateral proptosis. His age was 8 months and he had intensely enhancing bilateral cavernous sinus lesions. These are the bilateral cavernous hemangiomas. And the patient was sent to me for surgery at this region. Why on this earth I would operate? No, I would definitely give a chance to these patients of medical therapy, and not many people are actually aware that these cases can be very well tided over and managed by propranolol therapy. So I started this patient on propranolol therapy and this child improved and the surgery was obviated. So all these newer happenings in the field are kind of more so known to those who are practicing pediatric neurosurgery on a regular basis. And that's a whole crux of having it as a subspecialty, I would say. If you talk about my country, India, well, we all know that India is huge. We have a population of 1.28 billion. There are few centers in this country which are catering to pediatric neurosurgical services. However, they are not many. We have approximately 2,500 neurosurgeons in this country. However, if you talk about the pediatric neurosurgeons, they are less than 250 in our country. And this situation is actually the same all over the world, I would say. As per the WFNS statistics, the entire world has got approximately 30,000 neurosurgeons, out of which 3 major countries, US, Japan and Brazil, they have got only half of the neurosurgeons in the world. However, if you talk about the pediatric neurosurgeons, the population of the pediatric neurosurgeons all over the world remains a handful. Now, other thing which is very interesting is that India is a young country. 1/3 of the world population of the young adults live in India. 40% of the Indian population is children, and less than 14% of the Indian population is less than 6 years of age. We do have a declining incidence of the neural tube defects of the spinal dysarthrisms in our country. However, the tumors, the tethered cord syndromes and other things are on an increase. So what I'm trying to say that there's a huge voluminous population of these children with neurosurgical ailments which require to be treated by qualified neurosurgeons having good amount of experience in catering to this population. We began, I would say, almost 2 decades after the rest of the world. Pediatric neurosurgery came into real existence in 1950s in the world. However, in India, it started picking up in 1970s. The dedicated efforts of pediatric neurosurgery started beginning in 1980s, and it was established as a specialty in 1990s. We currently have got more than 250 members of Indian Society of Pediatric Neurosurgery. We do have a journal of pediatric neuroscience from our country. However, if you talk about the global front versus at my hospital or my country, we have got, in the present generation, we have got big names like Professor Diropo, Tekling Pang, Paul Steinmuck, and so many other neurosurgeons. However, if you talk about the dedicated pediatric neurosurgeons back home in my hospital or in my country, they are handfuls. But I just want to reiterate that is there really a need to have a dedicated pediatric neurosurgeons? Because that remains to be questioned and a hot topic of debate. The modern era of neurosurgery in my country actually began after India got independence way back in 1947. In fact, the two neurosurgeons, the Jacob Chandy and Ramamurthy Balasubramaniam, were the pioneers, the pillars of neurosurgery in our country. And subsequently, it was Professor S.N. Bhagwati who was instrumental in starting pediatric neurosurgical services in our country. We do have a membership of more than 2,500 plus neurosurgeons in the Neurosurgical Society of India, which began in 1951. And we do have a membership of more than 250 members in Indian Society of Pediatric Neurosurgery, which began way back in 1990s. These are the past presidents of Indian Society of Pediatric Neurosurgery of our country, the last being Professor E. Chidambaram. And these are the currently active pediatric neurosurgeons, I would say, who are kind of leading the modern era of pediatric neurosurgery. This is Professor A.K. Banerjee, Professor A.K. Mahapatra, Professor V.K. Jain, Professor Dev Pujari. In fact, the first National Pediatric Neurosurgical Symposium was organized way back in 1985 by Professor Raja Reddy from Hyderabad. And subsequently, our second National Pediatric Neurosurgical Symposium was organized in 1988 by Professor S.N. Bhagwati. We were fortunate enough to hold the 17th International Society for Pediatric Neurosurgery meeting in 1989, and subsequently our society was laid down in 1990s. These are the group of pediatric neurosurgeons from India. So the heated topic of debate, whether we really need to have an exclusive group of pediatric neurosurgeons. Well, John Shiloda beautifully mentioned in his article in Child Nervous System 1997, no, and I think I fully agree to that. The reason being very, very simple and clear. You need to manage your patients when they grow up to the adulthood. Like, for example, you have operated on a patient with a ventriculoperitoneal shunt at the age of 2 years, 3 years, 4 years, and when the child grows to 20 years of age and develops some shunt malfunction, who will treat? You want an adult neurosurgeon who has not seen any such cases to treat, or a surgeon who is having enough experience, or your follow-up case, you will be treating those cases. And naturally, if given a choice between a competent neurosurgeon who is not trained in fellowship systems and a fellow who is having just limited 1 to 2 years experience of pediatric neurosurgery, who will you offer yourself to? Naturally, you would like to get operated by somebody who is having a vast amount of experience of 10, 15, 20, 30 years in neurosurgery, as compared to somebody who has done 1 year fellowship in pediatric neurosurgery to operate on a child or on somebody close to you. So the common apprehension which neurosurgeons think why they do not take up pediatric neurosurgery is that they always feel that soon they would lose touch with the advances in neurosurgery. They feel that they will have very few meetings to attend to their schedule, which probably is correct. I do agree to it. These are the number of cases of pediatric neurosurgery operated in various centers in different parts of the world. The major academic centers are doing the major amount of chunk. At Institute in 2009, we operated almost 650 plus pediatric cases, and now in fact we operate more than 1,000 pediatric neurosurgical cases every year in our hospital. In fact, there are some dedicated pediatric neurosurgical centers. One being, which I know about, is in Chennai, the Children Trust Hospital, and another being the Wadia Hospital in Mumbai. Rest all places, the cases are being operated by adult neurosurgeons with special interest in pediatric neurosurgery. These are the common problems of the children which we commonly see in our practice. These are the different types of tumors, the incidence being almost approximately the same in different parts of India. We do have major contribution to the development of shunt systems or the ventriculoperitoneal shunt systems. In fact, some of our shunts, Upadhyay shunt, Chawla shunts, are being used all over the world. The Chawla shunt, being developed by one of the pioneer neurosurgeons of our country, is being used in major parts of the world because it is very, very cost effective and it works very well. Excuse me. We were a part of international infantile hydrocephalus studies, and we have contributed significant literature to the management guidelines of pediatric post-tubercular hydrocephalus, because this is one condition which is very, very commonly seen in our country still, though the incidence has come down drastically. Now the problem is because of the limited number of surgeons doing this activity in our country, we have a huge volume and we have a long waiting list. And that is why majority of the children are not able to get the treatment at the appropriate places in appropriate surgical hands. Now, what is the current pediatric neurosurgical services practice at institutes? What we have? Well, these are the kind of surgeries which we have been doing since 1972. Excuse me. We have been doing craniofacial surgeries since 1972. We have been doing neural tube defects, spinal dysarthrism, shunt surgeries, and pediatric head injuries, ICP monitoring, neuro-oncology, epilepsy surgeries, and recently we've started doing, in fact last 1 decade, we've started doing deep brain stimulation. And now, over last couple of years, what I have started is that I have started developing 3D print model based training for the residents. We are starting fellowships in pediatric neurosurgical 1-year course at my hospital. In fact, there are some centers in our country under the aegis of Indian Society of Pediatric Neurosurgery, which are already offering fellowships in pediatric neurosurgery to the fellows. And this present course of 2 days duration is the first of its kind online pediatric neurosurgical course available to the rest of the world. And of course, we are also doing some pediatric neurosurgical updates, which I think is something the need of the hour for people to learn what is new happening in the world of pediatric neurosurgery sitting at their desktop. So we do have regular ISP training fellowship to the AIIMS students since 1994, and Professor A.K. Mahapatra, one of my teacher, he has contributed significantly to pediatric neurosurgery at my hospital and also in India. We have an extensive work on molecular subtyping of pediatric medulloblastomas published. We have organized various international and national pediatric neurosurgical meetings at different time frames, and we have state-of-the-art cadaveric training labs, and we have got a soft tissue lab for teaching of the residents to learn the various techniques of how to do craniofacial and craniosynostosis surgeries in these children. So we are offering state-of-the-art management to these patients of cerebrovascular disorders and patients with all kinds of complex cranial and trauma. In fact, recently we are a part of approaches and decisions in pediatric TBI, which is the largest consortium of neurotrauma registry for the children in the world ever to happen. And this consortium is going to be a game changer in laying down guidelines for the management of severe pediatric traumatic brain injury patients. These are the kind of children which we see in a single outpatient clinic. 6 patients of spinal dysplasia of different types coming to you in a single OPD. And these are the 3D print model. In fact, I took this technique from one of my another fellow institute in south of India, Cochin, where I learned this technique and I started training it to our residents and young faculty how to do craniosynostosis surgeries on a mathematical model for these children. In fact, one of my colleagues will be talking about it tomorrow, who started this technique in southern part of India. We are doing extensive work on split cord malformations, myelocystosis. In fact, ours is the largest series in the world because we do see lots and lots of these children with these congenital malformations. And we have over 1,000 cases of craniopharyngiomas published in the literature over last 5 decades, and we have done some molecular subtyping and study of brain invasion in craniopharyngiomas. And this is again the kind of comparison of India with the rest of the world on the different kinds of tumors being detected and managed in the children. So we have done large amount of extensive work on the molecular subgrouping in medulloblastomas. We have been able to identify based on immunohistochemistry the different subsections of medulloblastomas based on the WNT, sonic hedgehog, and the non-wind pathways. And we have been able to prognosticate these children. These are the fish pictures showing the substratification of these non-MIC pathway group medulloblastomas. In fact, one of our faculty from Bangalore will be talking about these issues on neuro-oncology tomorrow in one of our lecture. So we are managing all kinds of pediatric craniovertebral junction and spinal abnormalities in these children. And recently, over last 2 years, we have started a center of excellence for pediatric epilepsy surgeries. In fact, now we have done over 850 such pediatric epilepsy surgeries, and we do have facilities like MEG, SPECT, PET, video EEG, and intraoperative brain suits and robotic device assistance for the management of these children. This is a center of excellence being there at All Institute of Medical Sciences. So we are doing over 1,000 pediatric neurosurgical cases almost on annual basis, and the incidence is increasing with the increased number of theaters and more number of younger faculty from my department taking up keen interest in pediatric neurosurgical services. So I think apart from what the clinical work we are doing, there is a need for awareness about various pediatric conditions among the pediatricians, neonatologists, and to make them refer these patients to the right person at the right time. And we do have a large population, and so we need large number of neurosurgeons in our country to manage these patients. And of course, we are now talking about the national programs to educate children, to educate people about the peri-conception use of folates and the need for spacing of pregnancies, family plannings, and ultrasonography at frequent intervals. And of course, we have started the various spina bifida clinics all over India. So these are the few modules I have developed back home in my hospital for the fellowship trainings on congenital hydrocephalus, neuroendoscopies, clinical cervical junction disorders, pediatric brain tumors, pediatric head and spinal injuries, and epilepsy and fetal surgeries. Our society has taken various initiatives in this direction. In fact, the Neurosurgical Society of India has already taken a move, and we did the first pediatric neurosurgery CME course in July this year in south part of India. The Indian Society of Pediatric Neurosurgery has taken various initiatives of starting fellowships, of offering resident fellowships, and doing some various sessions for the residents exclusively in their annual meetings, apart from conducting regular ISP and CME meets as a part of the annual meetings. We do have certain parts of the country wherein we are offering telemedicine facility to give advice to the remote areas, and the issue of remoting in remote areas is almost practically non-existent, I would say, in our country. So, but we do have a big amount of supply and availability gap, and this gap, I would say, is decreasing with more and more number of people taking active interest. So, and this supply availability gap, I would say, is actually persisting all over the world. Health industry in India is actually blooming. Economy is showing an upward surge. We do have new private centers, 3 Tesla MRIs, PET, endoscopes, MEG, and so many. You name a facility in the world, it is available in the country. And I would say that globalization, liberalization of economy, and promotion of health insurance are the two major new things happening in our country. The goals of a pediatric neurosurgeon, I would say, is to improve awareness amongst general population. He should be giving regular lectures on specific topics for pediatricians, general practitioners, healthcare workers, and conduct various educational programs. And these lectures should be actually repeated, to have kind of re-emphasize and reinforce the knowledge, and of course in the general public, say by a series of public awareness lectures should also be conducted by us. A section remains divided. There is a school of thought. People say that you should have a separate board certification examination for pediatric neurosurgeons, start some super specialty courses. I somehow differ. I feel that somebody should be inclined to do pediatric neurosurgery and a diploma or a fellowship of 1 to 2 years after neurosurgical practice is something which is required to become to be able to cater to pediatric neurosurgical populations. So I would say individualization of the pediatric neurosurgery promotes rapid and tremendous progress, and awful lot to be done still. It is far safe for a child to be operated by a neurosurgeon who has been trained in pediatric neurosurgery. However, there is a red flag to it, like getting operated by an experienced neurosurgeon versus somebody who has got just very limited experience. So I think, like what people say, you need to be a surgeon first, you need to be a neurosurgeon second, and then a pediatric neurosurgeon. I also believe that pediatric neurosurgeons are mutants like me. Their multiplication throughout the world and India demonstrates that a mutation was good, because the number of the people in this world are increasing. A word of caution: I personally believe that pediatric neurosurgery fellowship should be run at centers where there is a broad range of problems, the bread and butter of pediatric neurological problems, I would say, and not just the complex, unusual cases. I'll be very happy to send my fellows at a center wherein all gamuts of pediatric neurosurgical operations like spinal dysarthrisms, craniosynostosis, nasal and cuff flow seals, all kind of pediatric brain tumors, epilepsies are being done in one center, rather than sending my fellow for training exclusively for craniosynostosis surgery training for 2 years, 3 years altogether, because I want to have a fellow who knows completely about all the wide gamut of problems in pediatric neurosurgery, rather than getting himself restricted to one specific super subspecialty, which is not going to be very, very useful, I would say. I would say that competent neurosurgeons not trained in fellowship in pediatric neurosurgery is much better than a fellow with 1 to 2 years of additional training. And the most important thing for the young people who are watching me is that you should always talk about the history taking, because whatever the mother says or the patient attendant says is still just as important what scans shows. So history taking is again very important, I would say. All neurosurgical training should have a period of basic training in pediatric neurosurgical fellowship as part of their formal programs. That's my take on that. And children with neurosurgical problems are properly treated by those who are familiar and trained in work with the children. So, spinal discectism surgery, hydrocephalus surgery by general surgeons or pediatric surgeon, I would say no. Doing head injuries or decompressive anatomy by general surgeons, especially in children, I don't think it should be really promoted, except in very strenuous circumstances. And in those cases also, those surgeons should be well trained to do those procedures. However, this remains something which is even debatable now. So there is a need for well-trained pediatric neurosurgeons in India and across the world. There is a need for resident training in India and across the world. And the various incentives which we can offer is that to start and to promote and to take it further, the training fellowships to the residents and to the young people, giving award as a token of appreciation to the postgraduates and the trainees, and of course to have a better coordination between pediatric neurosurgeons, pediatricians, and neurologists and intensivists. And of course, we need to talk more about the educational fronts, take up the new models of so-called 3D printing, STL models for the training of the people to work on craniofacial surgeries. We need to create or kindle interest of pediatric neurosurgery amongst young neurosurgeons, and of course bridge this urban-rural gap. The various risk factors for the neural defects are known, and we need to increase awareness for the same. And I would say yes, we do not have too much of thing happening in the international front in pediatric neurosurgery, but these are the contributions from our society, our country, to the field of pediatric neurosurgery. Apart from ancient Hindu mythology, which I just talked about in the beginning, we do have contributed Chavra Shans, Upadhyay Shans, and we are the pioneers of starting spasticity surgery for these children. And of course, we do not have major patents as yet. However, I would say that one should be targeting more in creating interest in pediatric neurosurgery rather than creating more pediatric neurosurgical centers or exclusive pediatric neurosurgical centers. And I would say that initiative to start online pediatric neurosurgery course is one such innovative idea from India. You need to have some mentors. I did have a mentor like Professor Tiroko when I did my fellowships, and I do have my mentor and Professor Declan Pan and Professor A.K. Mahapatra, who have been constant source of guidance, and they have helped me out whenever I was in any kind of need for any patient management. We are able to do lots of complex spinal surgeries. And whenever I am in any trouble, I just shoot an email. Nowadays, with the internet being available to all the people, all parts of the world, I just write an email to my mentors, and overnight I get a reply, and I'm able to take my decisions in some of my challenging cases. So one should not be shy in asking questions or queries, or in management of difficult cases. People in Australia have done this beautiful study, which was published in 2015 in GNS. People talked about doing a mobile pediatric neurosurgery or rapid response neurosurgery for remote areas, wherein a group of surgeons, they actually, instead of taking a patient from the source of injury to a specialized center, wherein a lot of time gets wasted, through the facility of telemedicine, where the CT scans are provided to the surgeons actually went with a series of his armamentarium to the place where the actual incident of traumatic brain injury or a hematoma or life-threatening pediatric neurosurgical problem occurred. However, this is not really practical in most other part of the world. I would say one needs to train more and more of pediatric neurosurgeon and teach them more rather than doing this. So it is a teamwork which is the most important if you talk about the institutions. So I would say the beautiful tree of pediatric neurosurgery was planted in this country by Professor S.N. Bhagwati way back in 1990s. And now this tree has actually bloomed and grown up significantly to a strength of more than 250 members of our society. And now I think the time has come for our country wherein, and in fact for the rest of the world, I would say, wherein we need to say to the world, yes, pediatric neurosurgery is a subspecialty of neurosurgery which exists, which is growing, and it is not looking back. Thank you very much.
Thank you very much, Deepak, for an excellent presentation and overview of pediatric neurosurgery in India and overall. I'd like to ask Francesca if she has any questions or comments for Dr. Gupta.
Thank you so much, Dr. Gupta, for this incredible presentation. I think what's being done in India is more than impressive, and I agree that there is a constant need of pediatric neurosurgeons all over the world. And actually, my life goal is to become one, and everything I do is aiming to take me to that moment. But until then, congratulations to you. I have no questions yet, and I'm looking forward for the other presentations. Thank you.
Yeah, we're very lucky, Dr. Gupta. You brought a few pediatric neurosurgeons to this conference to give lectures. So I'd like to thank you for that. Now, is it a one-year fellowship in India to be a pediatric neurosurgeon?
Yes, we are doing it after neurosurgical training. As I mentioned in my talk, one needs to be a surgeon first, a neurosurgeon second, and then a pediatric neurosurgeon. American Board of Surgeons, there was a debate of having produced, people suggesting that one should take up pediatric neurosurgery right from the beginning. However, this is not something which is accepted by all over the world, and now people are talking about fellowships after doing neurosurgical residency. So we are offering fellowships for 1 year to the fellows who are qualified and certified neurosurgeons. And there are 4 or 5 centers which are already offering fellowships. At my hospital, we'll be starting it sometime next year.
Now, you mentioned pediatric neurosurgery online courses. Is that true? You have them now?
Yes, this is the first course I'm doing today, and for next 2 days, the beauty of this course, which I feel, is that the experts can give a talk for 40 to 45 minutes. They can speak a lot. Most of the conferences, when we give talks, the talk duration is 5 minutes, 10 minutes, 15 minutes, and you cannot really talk in detail about one topic of interest. Right. And when you have a surgeon or a pediatric neurosurgeon giving a talk for 45 minutes non-stop, I'm sure he can cover a lot. And a resident or a fellow, he need not travel to different part of the world, pay hefty registration fee, air travel charges to listen to such lectures. He can see that lecture at his desktop, not once, again and again and again. So I would say this is a beautiful and innovative concept, and I hope this comes to the usefulness of many people all over the world, especially those who are not able to travel to attend those conferences.
Yeah, I think you recognize this platform right away, the potential for what you're talking about, and I would highly encourage you to use this platform with us or without us in areas like pediatric neurosurgeons. You mentioned during a lecture lecturing pediatricians, I guess, with various topics. This would be an excellent platform for them to do so, since there's so few in countries like India and Brazil, etc. I highly encourage this platform, and hopefully we can work together doing that in the future. So, okay, thank you very much for your excellent presentation, Dr. Gupta, and thank you for assembling a top-flight cast of lecturers for this conference, and we look forward to seeing the rest. So thank you very much.
Thank you very much. Thank you.